Each year, healthcare payers and providers spend roughly $1 trillion on unnecessary healthcare expenses in the U.S. alone.
This is not a new phenomenon. Healthcare costs have been rising rapidly over the past few decades. Since the 1990s, we've seen healthcare spending outpace inflation, our population growth, and the gross domestic product. For example, in 1960, the cost of healthcare per person in the U.S. was less than $500 per year. In 2020, it's well over $10,000 per American per year. The healthcare spending for large group employers has been rising approximately 6% year over year. It's become the single most significant factor for employers and for corporate America. At the present time, the total healthcare costs for an individual employee are approximately $15,000 per year, and the healthcare cost for an employee with an average family of 4 is nearly $28,000 per year.
Helping to move the industry forward, innovations in science and technology are now making healthcare more comprehensive and accessible to everyone.
The largest technology companies have no interest in helping employers. Their health-related projects have been in other areas, such as partnering with big pharmaceutical companies, developing their own health insurance business, or helping hospitals store patient data. Helping employers and their employees has not been part of their business model. The employers are not fighting back for the following reasons. There is an issue of transparency in the health insurance industry. The employers don't have full visibility into prices and medical claims. In fact, the health insurance industry is the only industry where the customer is asked to sign an insurance contract, having no idea what the final price will be.
Today, machines are able to process medical concepts much faster and in much higher volumes than previous manual methods allowed. They help to eliminate human error and can also provide doctors with knowledge and information outside of their own expertise.
WellAI mobile app has been trained on over 30 million medical studies. It has absorbed a good chunk of humanity's medical knowledge. At the same time, Wellness Council of America estimated that fully 66% of emergency room visits in this country are not necessary. That leads to $14 billion a year in waste. Why does that happen? Simply because a doctor is not available. Maybe a nighttime or a weekend, or there's no appointment for a week. While WellAI mobile app is always with you. It can answer questions, it can make recommendations. Hi WellAI.
Which symptoms are you experiencing, Daniel?
My shoulder hurts and I have a low fever. All that based on scientific knowledge.
WellAI, located in Sheridan, Wyoming, has developed a novel software application that uses machine learning algorithms to read and summarize vast amounts of medical literature.
We are a bunch of data scientists, math geeks if you will, and we have been watching this disaster unfold in the group healthcare market and in the healthcare industry in general. About a year ago, we felt that technologies are mature enough and we can actually make a difference, so we started building WellAI. This is a deeply personal story for me. Many years ago, I was prescribed a medication that caused massive side effects and damage. I was also prescribed a surgery that was not necessary. All that for a mild condition, as it turned out. For years, I was balancing between life and death. My kidneys were failing, my liver was failing. I could barely walk, I lost a ton of weight, I could not work. Thankfully, I understand mathematical statistics, at least as well as the authors of those studies, so I was able to draw conclusions. Little by little, I was able to reverse much of the damage that happened and get back to a productive life. My friends, realizing that I read so much medical literature, actually started coming to me for advice. And that was the eureka moment for me. I realized that we can automate this process. Now, I don't like the term artificial intelligence. It's nothing like human intelligence, but these methods are very powerful. We can use these algorithms to summarize data and to answer questions, really, really important questions.
While digital assistants are not new in theory, the digital health assistant's ability to read many millions of studies is a complete game changer.
Conceptually, WellAI mobile app is similar to other personal assistants like Amazon's Alexa or Google's Assistant. However, the key difference is that it has been trained on scientific literature, vast amounts of scientific literature. We are not aware of any other tool that takes the science, deep science, to this degree and takes it to the end consumer. Specifically in the health market, most of the big data resources go to big players, while employers see increasing costs every year. WellAI mobile app is available on iPhone and Android, and in fact, we created a free version so you can download yours today. You can go to the App Store right now and download the free version of the WellAI personal assistant.
One of the problems with various wellness programs is the degree of adoption. Many people do not act on their health until an emergency strikes.
One of the most important things the WellAI platform provides is giving our customers an evidence-based picture of their health situation and plan of action.
Group health is the second largest expense for U.S. businesses after payroll. This expense is growing 4 to 6% each year, putting a tremendous pressure on companies and on employee compensation.
We've considered the following factors that are part of the cost savings model calculation: the size of the company, the number of employees with chronic diseases, the employee participation rate, or how many employees would decide to sign with the WellAI platform. In fact, according to our calculations, employers would save anywhere from 15 to 40% on average with the WellAI platform.
In addition, WellAI helps employers improve group benefits, reduce health insurance costs for businesses and employees, and create healthier teams.
If you're an employer, get a premium version for your employees. This will save you a ton of unnecessary medical costs. You will actually see your bills decrease. And if you are a doctor, talk to us because we can help you be more efficient. We are already in talks with large networks of independent doctors to help them use the WellAI mobile app to improve interaction with the patient and to improve the quality of the work that they do.
WellAI personal health applications are not meant to replace doctors. They serve as an additional resource for those who want to understand and improve their health using evidence-based science. For more information, visit wellai.health.